Hey, my name is Kristen Hardy, nurse practitioner student at Auburn University. Today we're talking about allergic rhinitis. You may also hear this referred to as seasonal allergies or hay fever. It is a non-contagious condition. Prevalence in the United States is increasing, and there is a large rate of people missing work and school associated with this condition, and a lot of medical expenses in relation to prescription medications are spent on this process. So common symptoms, you're going to have a runny nose, probably sneezing patient, possibly coughing, some congestion. They're probably going to have some itchy eyes, nose, and throat. They may have postnasal drainage, and some of these patients report fatigue. So pathogenesis, it is an allergic response. So basically your patient's going to have some repetitive exposure to some sort of allergen. Eventually it's going to start causing release of histamine, which is going to create an allergic type response in the patient, and eventually results in inflammation of the nasal passageway. Those that are at higher risk for this process are people that have a family history of allergic sensitivities, male patients, patients born during pollen season, firstborn children, antibiotic usage in early life, cigarette smoke exposure in early life, exposure to indoor allergens, and presence of IgE. All right, so to nail down a definitive diagnosis, you want to ask your patient if they have a known history of allergies. They may not. Also ask them if they have seasonal allergies or notice any repetitive patterns as the seasons change, and that could clue you into an allergic type response. And also looking at the mucus coloration, the mucus with this pathology or process is clear versus green or yellow, so that's a good clue that it's allergic. You want to look at the nose, assessing the turbinates, looking for clear drainage. Looking at the pharynx, you may see some cobblestoning patterns, some redness, indicating some postnasal drainage is present. And then also the eyes, they could be red, itchy, watery. Treatment, it depends on the severity of the illness and if it's intermittent or chronic. So pretty much definitely with all of the severity levels, you always want to avoid the allergen. So basically the treatment pretty much is the same for adults and children. Children less than 2, you want to be careful with any sedating antihistamines. Those can cause some agitation in children. But basically you're going to be looking at antihistamines. You can consider intranasal antihistamines. As the severity level increases, you might go to intranasal cromolyn, possibly oral steroids. Something that's very helpful is the saline irrigation and the inhaled corticosteroids. In some cases, moderate to severe, you may have to consider decongestants, and then even go into some sublingual immunotherapy or sub-Q immunotherapy have shown to be very helpful with allergic rhinitis. But pretty much are going to have your antihistamines, nasal rinses, allergen avoidance, and some corticosteroid use. Teaching points for these patients, prevention is key. So again, allergen avoidance. If the patient is really unsure of what the allergen may be, then it may be appropriate to refer them to an allergist for testing. And then once it is identified, just trying to avoid that allergen as much as possible. Some of these allergens are unavoidable, and so you can teach the patient how they can kind of preload to be prepared for those situations and minimize the response. And medication administration is important, especially when you're doing intranasal medications. You might want to tell them to do their saline rinses first and then administer their steroid treatment, so that the steroid treatment is not washed out. Or the oral intranasal antihistamines would be the same case. Do your rinses first and then the antihistamine second. And then treatment adherence. You just want to teach them the importance of maintaining these regimens, because a lack of adherence can lead to actually sinusitis, which is just where the sinuses become plugged, and basically bacteria start to form because of that, and then that would lead to antibiotic therapy. So here are my references, and thank you very much.